Welcome to Real Health with me, Karl Henry. Folks, today on the podcast we are joined by Professor Odhran Shelley, consultant plastic, reconstructive and burns surgeon and clinical professor of surgery at Trinity College Dublin. He specialises in treating serious burn injuries and supporting patients through reconstruction and recovery, including emotional and psychological healing. With Christmas approaching, he shares life-saving first aid advice, insights into burn prevention at home and at work, and practical tips from preventing children and families from common domestic burn risks. Welcome. I'm really looking forward to this episode.
Okay, thanks for having me, Karl.
Well, I think it's such a risk factor, and I don't think people really know what to do if something happens.
Absolutely. A burn injury can be devastating, and burn injuries for life, leaving somebody with both the scars that are both physical as well as emotional, psychological. And a lot of the time, injury can be avoided or perhaps reduced. And I think it's really important that everybody knows this and knows what to avoid and what steps to take if injured.
How did you get into this area? I'm always intrigued by people and their jobs and how they end up in their jobs.
Well, actually, I did an elective of mine overseas, as it happens. And when I was overseas as part of the College of Surgeons, I noticed that people who had surgery had a transformation in their life with a single medical intervention. I think that's something that surgery does, that a single operation can transform someone's life. And that really, captivated my interest, and that's one that's remained to this day.
Wow. And you love it?
Yeah, it's great. It's amazing. Surgery is amazing, and I think that doing reconstructive surgery, and I think, as you said, we are actually supporting people through their whole journey, and particularly with regard to burn care. It's an injury that lasts with people for life. There are people who I've treated who, to be honest with you, I consider as friends as much as anything else. There's a very close relationship that we have with people that we've looked after, and we genuinely care for them and want the very best for them.
What are the most common causes of burn injuries?
Well, there are two broad areas. There's the those that happen in the home, and there's those that happen outside the home. Those that happen outside the home can, of course, happen through industry or assault. For those that happen at home, and I think it's important at this time of year to reflect on it, adults and children probably get equally affected. We have to consider the different aspects of each of them. For those with young children, if they're toddling around in the house, they're at particular risk. They do something called cruising. So when they're just starting to walk, they're holding onto surfaces. They really are a little bit unsteady. And unfortunately, if one of the things that they grasp to hold onto is a pan of boiling water, or they pull in a kettle, it can have devastating results. So while half of the injuries we have, let's say, are adult and children, in children, they typically tend to be scald injuries. For adults, they are more commonly flame burn injuries. And of course, I think that's something at this time of year that we've got to be really mindful of. We're coming into Christmas. We've heard only this week the devastating consequences with the loss of life from fires. And I think it's really important that each of us takes the steps necessary to reduce fire risk in our own home, realising that things like candles can cause clothes to catch fire. People think, Karl, that clothing isn't flammable, but actually a lot of children's clothing is actually characterised as a toy, and it's highly flammable. And so if somebody little gets too close to a candle, it can cause really devastating injury. Of course, Christmas trees, which are wonderful and they're seasonal and the smell and so forth, but they're if you've ever seen a Christmas tree in a fire, they're absolutely incendiary. And
is that the same for artificial trees as real?
No, it's not going to be the same for artificial trees as for real.
Real trees are a higher risk factor.
They're high risk, right? They get dried out. So if you have one at home, consider putting it in water to keep it cool and so forth. And be mindful about lights, particularly about and turning them off. Nighttime.
Of course, because we all do that. We leave them on late into the night.
We leave them on or through the night, depending on the lights. But, these are all things to think about.
And are there particular lights that are
Well, I think there's probably
the LED or the newer ones.
Yeah, I think those are going to be lower risk than perhaps some of the older ones. Yeah, absolutely. So it's one of those things to be mindful of. And of course, fires are always unintentional and unexpected. So really good Christmas present to think about is a smoke alarm.
Yeah.
If you haven't got one already, that's a present for you and for the whole family. And so just do think about these things.
We got one recently. We went through the whole house and we put a few of them in. And in the kitchen, we put in a heat alarm.
Yeah.
Which which the fire chap recommended. He said it's a really good option because it's not triggered by the smoke from, say, burned toast or something like that.
Yeah, I mean, there's lots of different types of alarm.
Yeah.
There's heat alarms, fire alarm, there's smoke alarms, and of course carbon monoxide alarms.
Yep.
And each one of these things. So I think if you're thinking about it, give it a little bit of thought. There are fire officers around the country. There are people within the fire brigade and so forth. There are people who would be really happy to help and guide.
We got a great thing from our local. The same chap that we got the carbon alarm and the smoke alarm and the heat alarm off. He gave us a sticker, or a magnet for the fridge.
Yes.
With our air code on it, and he wrote our air code on it before he left.
Yes.
So everyone who comes into the house, if they're ever there on their own, knows exactly where we are.
And that's a great idea.
Brilliant.
That's such a great idea, because if there is an emergency and you've got a babysitter and they go, where do you live? Well, actually, I don't know. I know the family, but actually I don't know the air code. So it's actually really small, simple stuff like that that's super important.
Has the treatment of burns changed over the course of your career?
Yeah, I think absolutely it has. And I'm delighted that it's a very multidisciplinary team. So a huge amount of work from nurses, therapists, intensivists, as well as surgeons. Nowadays, we really focus on doing early interventions, so early surgery, getting rid of all that really damaged and burn-injured tissue, which actually becomes a trigger for inflammatory responses and for being quite unwell in a critical care setting. So through early surgery, very aggressive, supportive therapies, I think the interventions have definitely brought about significant improvements in burn outcomes. We've been very privileged in a way to look after some of these people, and I've had under my care people with 97% full thickness burns survive. Now,
97%.
Now that takes a lot of work. And that takes everybody on the team, giving their best game. But, so we can actually get somebody through it, but that is dependent on the individual. Obviously, younger people are more likely to survive. Nowadays, we know that people who are older, they're a little bit more frail, but we're all living longer, thankfully. And of course, injury in somebody who's a little bit older, they may have lots of medical problems, more challenging.
Okay, so can I ask you, a burn happens at home.
Okay.
What do we do?
Well, the first thing is to a very, very quick assessment of the situation. Is the situation safe? If there's an electrical injury, what's going on? Does the electricity need to be cut off or something like that to remove the person from the source of injury? So, of course, if there's a flame, if it happens in the kitchen, fire blanket, going back to those kind of silly things, using things like that to extinguish the fire. If somebody has a skull burn injury or indeed another injury,
I did mine. Where is it? It's on that arm. I did mine against the fire a few weeks ago.
Right. So what we'd say is, look, you're going to dissipate the heat, hopefully reduce the amount of injury by putting under cool water for 20 minutes.
20 minutes, okay.
20 minutes. And to do that within the first 4 hours of injury. So if you see somebody and they've not done it yet, now there's one caveat. You have to make sure that the person doesn't get too cold. And of course, if you've got a child or something, you've taken off all their clothes, you're putting them in the water, and in the shower is a very easy way to do something. But they'll get really cold very quickly. So you've really got to be very mindful of that. So once you've done that, what I'd suggest is put some cling film on. Cling film is a really easy,
of course it is,
readily available tool to close the wound, because of course it's really stingy and sore because the nerve endings are all exposed because the outer layer of the skin has been taken away and damaged. And so if you put some cling film on, it's a really quick way to kind of seal the wound. And of course,
when you get tattoos, which I've one or two of them, of course, after your tattoo they put on cling film.
Cling film, yeah. So it helps to seal the area. It protects, because our skin is a barrier against the outside world. If you've had an injury, you're now losing fluids through the wound, you're losing proteins, and of course infection can get in. Something like cling film is a very quick, simple, easy way to quickly wrap something up while you're waiting for medical attention to see your local medical expert.
So we prefer cold water over ice.
Absolutely, absolutely. And people go, oh, I'll make it cooler with ice. Of course, ice will numb, but there's a risk with ice. You can get frostbite injury. So if you've now got somebody who's got a burn injury, then you add ice directly onto the wound, it'll actually potentially give that someone a second injury.
Oh, wow.
So rather than helping, actually make things worse.
Okay, so cold water, 20 minutes.
20 minutes within the first 4 hours.
And of course, you're watching for hypothermia risk.
Yeah, absolutely, absolutely. So if you've got a little one or even an adult, whatever, put on a warm blanket or some clothes on afterwards and make sure that they're kept warm, because they will get cold surprisingly quickly, and that can cause other problems.
And is the response relative to the severity of the burn, or is it across the board? That's pretty much they're the key response things to do.
Those
Obviously
are
in
the key,
extreme cases.
those are the key response things to do. But it's a good question. We know that for smaller burn injuries, they're burns now up to, let's say, 20% of the total body surface area. There's obviously a local effect. There's lots of inflammation and so forth. But when you get a larger burn injury, or when a person's had a larger injury, then that inflammation actually starts to affect all of the organs in the body. So people can get impairment and failure of other organs, even ones indirectly that weren't damaged by the injury itself.
And people will have heard of, first degree, second degree.
Yep.
Talk us through just the general differences, or how that scale works.
Sure, yeah, it's a really good question. I mean, in the past, and even still today, we talk about it, first, second, third degree. The idea is one where the first degree are those more superficial injuries, and the third degree represents a full thickness or a deep injury, where the full thickness of the skin has been fully damaged by the injury. And in this setting, recovery is less likely without surgery to take it away and perhaps do a skin graft. Sometimes injuries can extend even beyond the skin and into deeper tissues, like our fatty tissues, or even muscle and bone, for people who've had really deep injuries. And of course, those will need far more complex reconstruction. So first degree is a more superficial injury, third is a full thickness, and the second are those in between, because sometimes it's not exactly clear. And the thickness of our skin will vary from one part of the body to another. So exactly the same depth of injury, you can imagine, might actually be only superficial in some parts, but end up being the full thickness of the skin in somewhere that's actually relatively close by.
We chatted about some of the risk factors, or some of the risky things around Christmas time. Obviously, around Christmas, batteries are another problem.
Yeah, no, absolutely. And, there's particular batteries now that people may or may not be aware of, which are lithium batteries. Lithium is something that's highly flammable.
So they're batteries that would be found in
rechargeable
e-bikes,
and rechargeable.
scooters.
So, yeah, absolutely. So I'd really urge everybody to be very, careful, particularly about those larger batteries, lithium or rechargeable batteries that can heat up. We've all had that experience where you've had a battery, even your phone, in your pocket, and you go, my God, that's gotten very hot. Computers as well. What we don't realize is that if they get a little bit too hot, or there's too much charge going through the battery, that battery can then actually catch flame.
Oh.
And two things. One, they're not possible to put out by conventional means.
Wow.
And second, they produce a lot of very toxic substances, including acid plumes. In other words, they produce acid smoke, which is incredibly damaging to the lungs and to the organs in general.
So what we're saying to people listening is, where you store your rechargeable devices is really important, whether it's a drill or a scooter or a bike, where you store them and plug and charge them.
Absolutely. And I've had people who've come in who've been charging them in their bedrooms, and then suddenly, with only seconds, it's gone from there being nothing to there being a complete combustion.
My God.
And where they've had difficulty in getting out of the room. Literally to the point that somebody else had to push open the door. Other people have had them in their passageways outside the room. They're in apartment complex and so forth. And this is very common, of course. A lot of people working in the gig economy. And they've got their rechargeable scooter or whatever in the hallway or whatever. But if that goes alight and you can't put it out, nobody can get out of the apartment.
I'm thinking as we chat where my e-bike is at home. It's in the shed, thankfully, where it charges there. But yeah.
So, something to be really, really mindful of.
And can I ask you, Does that change with the quality of the product? My point, what we're trying to get at there is like, say, a cheaper e-scooter, which loads of people are going to get for Christmas, versus a more expensive one that's from a reputable brand. Is there a difference in the fire risk? That's a tough question. I know that.
No, it's a very tough question, but it's a fair one. And like many things, there's probably not a clear answer to it. All of these things have got an inherent risk of combustion. And we all know when we use chargers that certain chargers work better than other. Certain chargers, have got transformers within them that will change the voltage. Oftentimes, what we do is we go, oh, that charger works for my device. I'll just use that charger. But chargers may be designed to be used with specific devices, and often, actually, we don't even realize the difference between them. And I think one of the suggested problems is that the actual chargers themselves are perhaps incompatible with the device, and all that they can actually be used, but actually that they're delivering voltage and current at perhaps not the ideal to charge that battery. That battery is then getting overloaded.
That's important to know, isn't it, for people listening in?
Absolutely.
Like, you need to, and we've all done that, myself included.
Yeah,
it fits. It's the right charger, or it's the right plug.
It works. Yeah. It works, and we all know that certain chargers work more slowly and certain chargers work faster. But actually, the physics of this is beyond me. But certainly, when there's a mismatch in the current delivery and so forth. So I think the lesson is just be very mindful, be very aware. If you've got if you're charging something, how long does it need to be left in charging for? Do it perhaps in a supervised way. Do it in a safe way. Do it in a place where it's going to be safe. That if something were to happen, that actually that risk would be mitigated.
Are phones a risk factor?
Yeah, we have seen that in the past where phones have actually themselves, caught light, and they can cause really nasty injuries. They can don't want to frighten anybody.
No,
but I've seen it where they've,
the expert.
I've seen it where they've suddenly exploded in someone's pocket and they end up with a really deep burn injury.
I can see Adrian Weckler on his Tech Talk podcast for the Irish Independent doing an episode with you very, very soon.
Sure, you're very welcome.
But a lot of that is like going back to our previous point is down to matching the charger, the plug, the cable. That it's actually it's the right one for the product, as opposed to just plugging a random one in.
I think so. And of course, to be honest with you, I'm not even sure I know which is the right one for my phone at home at the moment, And so, we're in this world now where there's universal ports and so on and so forth. But so the thing is, I suppose, to have an awareness, it's about kind of being aware of risk and then controlling risk. There's always going to be a risk there, but it's about being aware of it and then controlling it.
Can I ask you, seeing as we're both tea drinkers,
yes,
burns to the mouth or lips or tongue, how does one... There will be lots of that over Christmas. I'm sure we're all getting back together. How does one manage that?
Well, I guess in the same way, first off, being aware of it as a risk, isn't that right? So you have to be aware that when you're, drinking tea and so forth, that the tea itself is a risk, not just to you, but to others, little people particularly. If you did burn your tongue, well, really, cold water, you're going to try and cool it down. It's probably not going to be possible to stick your tongue under a tap for 20 minutes. And
cold water is the way to
cold water. Cold water is the way to alleviate it. Yeah.
Okay. Yeah. And are there any medicines, or I've seen some oral ones potentially that? Well,
look, to be honest, there's lots of products. The simplest and most effective one that we recommend is simply water.
Okay, great.
To be honest with you.
Yeah.
There are lots of things that perhaps got antiseptic qualities and so forth. They may be useful at a later time point if somebody's got a dressing. But the cold water or cool water will allow the heat to dissipate, provide comfort. It's universally available. And so it's easy to use.
For families or individuals who are looking at burns recovery,
yes,
chat me through about kind of nutrition with regards to that, or other tips.
Yeah, well, absolutely. It's very much a multidisciplinary team. Yep. There's huge consequences of a burn injury actually to the metabolic effect. The actual metabolic needs of the patient can increase by up to 50% and remain increased for 2 years after recovery from the injury. So what happens is, following the injury, there's a reprogramming. Essentially, the body is actually running almost like a marathon the whole time. And of course, to support that, the individual is going to need more calories. They're going to need more proteins because they've now got to rebuild their skin.
Protein,
they've got
growth,
to rebuild
and repair. Yep.
yeah, growth and repair and so forth. So something that's really important. And, we've got fantastic dietitian and nutritional support within our hospital. And we also adopt other strategies as well, actually. We do things like giving anabolic steroids.
Oh, yeah.
Yeah, so we give, non-virilizing testosterone is the drug that we use. Of course, everybody, male and female, produce testosterone. And that's something that's protective against muscle. So we protect against muscle loss.
Mm-hmm.
And other things that we do are we deliberately try and reduce the person's metabolic rate by reducing their heart rate. So we give them beta blockers.
Oh, yeah.
We try and slow their heart down. So we do a lot of kind of maybe funky stuff to try and attenuate the metabolic response following
It's really
injury.
interesting. It really, people often think burns as being quite simplistic. It broadens. You can see the scope and the level of research.
There's a whole sphere, absolutely. I mean, the critical care aspect is really interesting. It's very intricate, and a lot of good things have been done.
So I think really from the chat, we've got the advice now with regards to water being so important, cold water being absolutely crucial. That 20-minute time frame if it's a burn on the skin or something similar, calling obviously for emergency services if required. And it really is prevention though, isn't it? That's where a lot of it starts.
Absolutely. There's been some good studies in this, and they've shown that actually smoke alarms, fire alarms and so forth have saved more deaths than almost anything else. Oh. So absolutely. It's about being aware of the risk and trying to reduce the risk. It's about us all doing our bit. It's being sensible as you have, obviously, with getting all of your alarms fitted in. And it's about, let's say, as you come to Christmas, kitchen's going to be a really busy place. There's going to be lots of people running around. There's going to be things bubbling on the stove, and there's going to be things in the oven. There's going to be lots of children and people who want to come and help in the kitchen. And it's about, being aware and saying, look, don't, and being aware of people toddling, putting things out of reach. Maybe about explaining to children even at the start, saying, look, this is very dangerous. This can be very sore. This can cause you some,
I've tried that with my 6-year-old. He doesn't always listen.
Doesn't always listen, but they want to help. So it's about maybe they want to help, giving them something a little bit simple. And then it's about, all just looking at, candles. Candles do catch light. Mm-hmm. Be very, very careful. Often there's lots of them around, and look at all the drapes, look at all the clothing. People are particularly wearing loose-fitting clothing. So that's skirts and stuff that are billowing around. You don't realise. And then suddenly they've caught. So for you and I, we're wearing kind of tight-fitting clothes. It's not going to be quite so much of an issue because our sense of where our body is in space is pretty much where our clothes are in space. But for people who are wearing big and fancy dresses and so forth, actually they don't realise that there's a piece of their dress or what they're wearing which is 30, 40 centimetres over that direction, and that there's a candle just exactly there.
And the alarms and the detectors, they're often one of those things we all say, I must do that, and I must test it, which people forget to do as well.
Yes, that's right.
Off the back of our conversation, we were asking people to do that for Christmas, to test all your alarms.
Absolutely.
If you haven't got them, get one. If it looks dodgy, don't put it on the tree. From a lights perspective,
that's right. Yeah.
And where you store your renewables or your lithium batteries is really important. If it's a scooter or a plug-in renewable, where you store it is really important.
Yeah, I think so. And maybe as men, I know I'm often a terrible guy when it comes to buying presents. You can say, look, as a guy, let's maybe take it on ourselves and say, let's maybe do this for a family for Christmas, and say, let's get some smoke detectors. Let's get some carbon dioxide.
Great present.
It's a
brilliant present.
It's a brilliant present, isn't it? I mean, it's one, and it's the best money you'll probably ever spend.
We found our guy at a local town fair in Bandon, and he had a stall, and he was very clever, right? So the local fire brigade guy with him, and the kids got to try on the fire suit and the helmet, and that was his way of getting us over there.
Yes, absolutely.
And once we were there, we were like, actually, I need one of them, and I need one of them. And he was like, this is what it was brilliant. It was just one of those things we hadn't gotten around to. So it's really good advice. Before we go, I know you are involved in a charity in West Africa that you'd like to give a mention to while you're here.
Yeah, I would. Separately, I've been a trustee and the chairman of a charity called Research Africa. One of the burn paradoxes is that those people who are most likely to have a burn injury are the ones with the greatest difficulty in accessing it. And I've been delighted that we've managed to get support to build a burns unit in Connaught Hospital in Freetown in Africa. We've trained surgeons, and I'm shouting out to everybody out there, we've got the first trained surgeons from Sierra Leone that we trained in Ghana, thanks to a colleague of mine, Apoko and Poma. And we've got a female surgeon as well, Dr. Martha Ford, who's training in Ghana, Dr. Eric Wango, Dr. Abdullah Jallo. They're our plastic surgeons in Sierra Leone at the moment. We're delighted with them, and A.B. Cole, who helped to fund it. So really delighted. And, you know, it's really important for all of us, I suppose, as we're working our way through the world to give a little something back, to try and make it better for everybody. And, you know, hopefully this is something that we can do to make things a little bit better for those people who have the greatest access and accessing care.
One of the favourite parts of my job from a podcast perspective is that people come in who love their topic. They just have a graw for whatever their chosen topic is. It could be, it doesn't matter what it is, but they absolutely love it.
Yes.
And they're just passionate to get to talk about it. And that last 25 minutes on burns has been absolutely that.
Well, I'm certainly passionate about it.
You love it. You can see it.
Yeah. It's wonderful. I mean, and I suppose the last thank out, I'd really like to thank all of my colleagues, all of my nursing, therapy, all the health care professionals that I work with, who are absolutely fantastic, intensivists, theatre and so forth, because, you know, it's very much a team sport. Mm-hmm. You know, getting somebody better isn't just one person, it's about the whole team, and it's often for life.
Well, hopefully we've done a lot of good for people who are listening in today and watching us today in terms of burns prevention. So thank you so much for coming in. We really appreciate it.
Thank you very much, Carl.
Folks, that is it for another episode of Real Health with me, Karl Henry. As ever, you know where we are, at Karl Henry PT on Instagram, realhealth.independent.ie, and on the Irish Independent website. Really important content today. Check those lights, check those smoke alarms. It's absolutely crucial that you do so. And mind where you store your scooter, because it might just save your life. We'll see you next week. Slán go fóill.